Hi everyone, hope we are fine. Thank you so much for tuning into my YouTube channel. Today's topic is on cervical cancer. And I want to start off by the term itself, cancer, excluding the cervical first. What the term cancer means is abnormal proliferation of body cells. So they could be the cells in the bones, the cells in the GI tract, the cells in the skin, or the cells on any part of the body. They proliferate abnormally. What the term proliferation means an increase in production of the same forms coming from the same parent line. So what the term cancer really means, it really means an abnormal increase in the cells of the body. The body begins to make cells in an abnormal way. They begin to grow. And the term cancer comes from the Greek word, which means crack. And that word is carcinoma. So that's the same word where cancer was derived from. And the term cervical means really pertaining to the cervix. So what the term cervical cancer means is really cancer of the cervix, where the cells of the cervix begin to proliferate, to grow abnormally in number, and they can move. And when the cancer has moved from a primary site to a secondary site, we term it that the cancer has metastasized. It has moved from the primary source to the secondary source. And this is what really cancer is. It can either be malignant or benign. Benign cannot move, it cannot spread. The malignant cancer can spread. So what we are really talking about today is the term cervical cancer. It's specifically the cancer of the cervix. And this cancer grows slowly. And at the beginning, it shows no signs when it's in its earliest stage. So it's very, very difficult to identify because it begins without symptoms. It cannot show symptoms. But it can only be seen with a test, which is the Pap test. And the Pap test, this is the test which was discovered or developed by the Greek-American doctor called Georgios Papanikolaou in the year 1923. And what really this is a microscopic examination of the cancer cells in the cervix. And it will detect the presence of viral infections, and one of the viral infections is HPV virus, the one which causes cancer, the HPV virus. And what this really means, the HPV virus is the human papilloma virus. So this human papilloma virus is going to be detected by the Pap test. That's when we can detect this. But without testing it in the earliest stages, it is very, very difficult to identify. And one of the things I want to talk about now are the predisposing factors for cancer. The first one is smoking. Smoking is very harmful. So the first predisposing factor for cancer is smoking. Why is it that smoking can predispose someone to cancer? Well, it is very simple. In tobacco, there are chemicals, and one of the chemicals is nicotine. And what nicotine does in women who smoke is that it suppresses their immune system. it's going to suppress their immune system, and then when it suppresses their immune system, then that will cause the papilloma virus to take advantage of the decreased immune system of the woman, and then it will go on and lead them to cervical cancer. And the other thing that nicotine does is that it's going to go in the blood, it is going to circulate, and once it's circulating in the blood, it is going to go through the cervical mucus, and in the cervical mucus, it is those same nicotine products which are going to cause the damage to the DNA cells, to the DNA in the cells of the cervix, and that will predispose the woman to cervical cancer. That's all about smoking. Suppresses the immune system, makes the body less susceptible to HPV, the cause of cervical cancer. The other thing is that it's going to be in the cervical fluid, cervical mucus, and it's going to damage the DNA of the cells in the cervix. And the second thing I would like to talk about, decreased immunity. It is quite true that women with decreased immunity are susceptible to cervical cancer. It is because this makes the HPV virus to take advantage of the suppressed immune system and therefore cause cancer. And this is one of the reasons why most women with HIV and AIDS, they are at risk of developing cervical cancer. This is due to the fact that the HIV virus suppresses their immune system and makes the body susceptible to the HPV virus, the human papilloma virus. The third thing I would like to talk about is diet. Now, how does diet come in about? Well, the reason why it's diet, the poor diet can contribute to cervical cancer. And this is because, for example, when someone is eating vitamins, the diet which is not rich in vitamins, such as vitamin C, A, B, all those vitamins, which are very important in the build-up of our immune system, then their immune system will go down. And then that will make them susceptible to the HPV and therefore predisposed to cervical cancer. And on diet itself again, if the diet is very bad, you are eating a lot of fat in your diet, then you are most likely to become obese and overweight. And what the body does in women who are overweight is that there is going to be increased production of estrogen, which is going to cause the growth of new tissues. And in the endometrium also, there's going to be the growth of tissues, even in the cervix, therefore predisposing the woman to cervical cancer. The third thing I would like to talk about is genetics, one of the most important things. It is true that women who come from the background where their parents or anyone else in their background has suffered from the cervical cancer, then it will be in their gene, it will be in their blood, it will be passed on from one generation to the next. That's the reason why these women may be predisposed to cervical cancer. For example, if someone had a mother who had cervical cancer or a sister, that person is more likely to develop cancer, which is cancer of the cervix. And the other thing I would like to talk about is the poverty. Poverty is one of the most contributing factors to HPV in the developing world. And I'll list it, and I'll talk about it, how it comes in, how it affects women. Now, poverty, people in less developed countries, For example, people with low social income, they won't have access to the Pap test. Remember when we were introducing our topic, we said that the Pap test is the test which is used to examine the growth of cells in the cervix. And this one can detect cancer cells in its earliest stages, because without this, we cannot really detect cancer in its earliest stages because it typically shows no signs and symptoms. So people who are in poverty with low economic status, they are not going to have access to this Pap, the test which is used to test to examine the cells of the cancer. Of course, it's a Papa Nikolai, the Greek American who discovered this test in 1923. So poverty is one of the contributing factors to this. And the other thing is age. Age. Now the reason why age is included is that people who are younger than 25 years age they are more predisposed to having cancer when they start having children less than 25 years age. The reason is when the women are giving birth, their cervix normally dilates and stretches itself. And when the cervix is of the younger generation, it's not going to dilate at an even rate. It's going to dilate such that it's stretching the tissues of the cervix, and that can cause rupture of the cervix. And for such reasons, the women will not have access to the Pap test. The reason is because this test is very painful. It is very painful. The doctor is going to insert the instrument in their vagina, in their cervix, and then it will have to dilate inside so that they can have a proper view of the cervix. But when you have the rupture of the cervix and you have problems with the cervix due to maybe you had a baby at an early age and then your cervix dilated to a much extent level whereby you don't want to tamper with it, then this test is going to be very painful. So you are predisposed to cervical cancer. The other thing I would like to talk about is chlamydia infection. Now, chlamydia infection can predispose someone to cancer in the way that this will lead to pelvic inflammatory disease, the PIV, and the PIV can later go on and develop into cervical cancer. And this is bad because this one is sexually transmitted infection. The most important thing, the other thing I would like to mention is you guess what it is? Well, it's simple and it's one of the most important things. And it's the reason why most men are told to get circumcised, because if they are not circumcised, they are going to infect their women with the HPV virus, the human papilloma virus, and then they will be predisposed to cancer. And this point is sexual intercourse with multiple partners. Multiple sexual partners. And it is clear that the more sexual partners you have, the more likely you are at risk of developing cervical cancer. Next, we want to talk about the signs and symptoms for cervical cancer.